the most important thing to know and for women to think about is to optimize their general health. So it's not necessarily tricks or a bunch of new medications or huge changes in diet, but if they can optimize their overall general health, that's the absolutely best thing they can do going into pregnancy.
And it's also good to make sure that you're up to date on vaccines. So women who haven't, for example, had chickenpox in their life should get vaccinated against that. Chickenpox during pregnancy can be a pretty severe and even sometimes fatal infection. Rubella is another one. It's a live virus, and it's something that if women were infected during pregnancy, it's one of those viruses that you may not even know that you're infected with, but it can cause congenital deafness, so deafness of the developing fetus. And it's one of the more common causes of congenital deafness in the world. So getting vaccinated against that prior to pregnancy is a good idea. Rubella is not a vaccine that we can give during pregnancy because it is a live virus.
I encourage women to have a visit with their primary care doctor, whoever that may be, to check in on basic things that you may not notice but could be significant to your health, so they can do a general screening for diabetes as well as check your blood pressure, as those are more common chronic medical conditions in this era in otherwise seemingly healthy young women. I encourage women who are already exercising to absolutely continue that. It's one of my most favorite questions, actually.
Yeah, I agree. Exercise is just as important in pregnancy as outside of pregnancy, and women should definitely continue any kind of exercise regimen that they have. Women should keep their pulse less than 140 while exercising, so some women will wear a heart rate monitor to check that or just feel their pulse periodically and make sure it's under 140. And it's a lot easier in pregnancy to get there.
We recommend that women, if at all possible, enter pregnancy at a healthy weight with a BMI between 18.5 and 25. And you can have a visit with your primary care doctor to talk about how to achieve that healthy weight prior to pregnancy, if that's something that you're able to do and you're considering conception.
It's also important to minimize alcohol use or any kind of other potentially toxic exposures during when one is trying to get pregnant, and this would include any kind of drug use. There's certain medications that are really not okay in pregnancy, but also recreational drugs are really something that one should abstain from. Also, taking folic acid while trying to get pregnant is important. It's women can get the appropriate amount through a prenatal vitamin, so taking just a prenatal vitamin while trying to get pregnant is a good idea. And then for some women, if they have any kind of underlying medical condition, any disease that might become a problem during pregnancy or that may raise a concern about issues during pregnancy, women can always come in for what's called a preconceptional consultation with a high-risk obstetrician and talk about really what is the effect of pregnancy on their underlying disease and what would the underlying disease, how would the underlying disease affect pregnancy.
One of the most frequent questions I think we get is about medication safety during pregnancy and whether I should stop my medications before getting pregnant. Although I completely agree that there are some medications that we definitely recommend avoiding during pregnancy, surprisingly, the overwhelming majority of prescription medications are actually safe to continue during pregnancy, and for women who require them to otherwise be healthy, it's important to stay on those. So before discontinuing any medications, we encourage patients to touch base with the doctor that prescribed that medication for them, and in most cases, we'll encourage you to continue that medication. There's a difference between genetic screening and genetic testing, and I think this is confusing even for providers. There have been a lot of changes in the field recently. For women that know that there is something in their family history, within their family or their partner's family, that they've already been told by someone is inherited, it would be absolutely important for them to have a genetic consultation, and there may be some genetic testing options available for them or their partners before pregnancy.
And that's also true for women who have had a history of some type of difficulty during pregnancy, perhaps a poor outcome in an earlier pregnancy that had any kind of relationship to a genetic problem, or even a prior child with any kind of particular issue or syndrome. Then genetic counseling is available, and it's always wise if there are any questions about something, if that hasn't already occurred, then to come in and speak to a genetic counselor and to learn more about the condition, about its potential recurrence, about options to potentially reduce recurrence, and to come up with a plan.
There are some communities and special populations that have a higher prevalence of rare inherited diseases. And for those particular populations and communities, it can also be important to do something that we refer to as genetic screening that would screen for the individual being a carrier of these rare conditions. Some of those populations include French Canadians, Ashkenazi Jewish families, people that are known to have sickle cell, so that can include African American women or women and their partners.
Congratulations on considering getting pregnant. It's an exciting time in one's life, and pregnancy can be a really wonderful time, and most pregnancies are fine and healthy, and it's good to consider ways to optimize that, but also to enjoy the process.
And I think a lot of women worry, read lots of books and see lots of things online and talk to their friends. And I encourage them to do all of those things. But the truth is, if you can just sort of think about generally optimizing your overall health and having a well-balanced, healthy diet and continuing activities that you enjoy and that keep you physically active and healthy, those are really the biggest things that the majority of women can do for pregnancy.